Welcome back to Where is the Money? So it has started. Healthcare layoffs are here. Now, some of this is based on the way the economy was before Trump got a hold of it, but Trump has definitely escalated it to a new level.
Hundreds of workers at Children's Hospital Los Angeles are being laid off. The job cuts are taking place as the hospital restructures to remain financially stable. KTLA's Omar Lewis reports from East Hollywood.
The hospital is citing growing financial challenges as the reason behind these staffing changes and layoffs that will impact more than 400 positions across just about every department here at the Children's Hospital of Los Angeles.
Hundreds of people are looking for new jobs after Sentara announced it will cut roughly 400 positions. These reductions come after the company announced it will discontinue non-dual Medicare Advantage prescription drug plans by the end of the year.
Nurses are getting laid off, clinicians are getting laid off, rural hospitals due to the cuts is coming down. So a lot of things is going to be affecting the healthcare sector right now. So let's jump in and see where we are with the state of healthcare.
Jefferson Health in Philadelphia has announced plans to lay off about 650 employees. This is about roughly 1% of its workforce of 65,000. The health system cited ongoing financial pressures, including operating losses and significant cost challenges. Leadership described this decision as difficult but necessary to align operations for the future. So at this time, Jefferson has not shared which departments or roles will be affected, leaving uncertainty about whether clinical, administrative, or support staff positions will be impacted. The layoffs follow Jefferson's 2024 merger with Lehigh Valley Health Network, which created one of the largest health systems in Pennsylvania with 32 hospitals and more than 700 care sites. Earlier this year, Jefferson also outsourced some back office functions, affecting 171 roles. Financially, Jefferson has faced major setbacks. Fitch Ratings recently downgraded the system's outlook from stable to negative, citing nearly $200 million in operating losses. These layoffs are part of broader efforts to stabilize finances and restructure services. For healthcare workers, this raises concerns about increased workloads, staff burnout, and potential effects on patient care if essential roles are reduced. For patients, it may mean longer wait times and reduced access to services. As hospitals across the country face similar financial strain, these workforce reductions continue to show how economic instability in healthcare directly impacts both staff and patient safety.
More notable layoff was Jefferson Health. Jefferson Health have been downsizing, laying off hundreds due to the cuts. Trying to mainstream operations, they're going to be cutting $1 trillion off of Medicaid. So we're going to see how much money that cuts out of the hospital's pockets.
While hospital leaders did not elaborate further on the growing financial challenges the facility faces, the news comes as hundreds of billions of dollars in Medicaid cuts are also looming across the country. The hospital's CEO, Paul Viviano, released a statement that reads in part, "This was a very difficult decision and it is a deeply painful moment for our entire team." The statement goes on to say it became increasingly clear that reductions to both team member and management roles were necessary to ensure CHLA can continue to survive in this uncertain climate to provide our young patients and their families with the quality care that they need and deserve.
Some people feel like these hospitals, these businesses are laying off because they can, not because they need to. They are making a lot of money, and they've made a lot of money in profits for their shareholders. They're cutting people even though they don't need to, just to keep the pockets fat for the administrators and the shareholders. So we, as the everyday people and the workers, are getting stuck with the bill.
If you haven't figured this out yet, healthcare in the United States of America is a for-profit business. And if you're in the Philly area or Lehigh Valley area or Philly, region, you might have seen an article today that Jefferson Health, which just recently merged with Lehigh Valley Health Network a couple years ago, is laying off 600 to 700 employees. They're just laying them off, claiming that they need to do this for financial reasons to keep the organization strong. What you didn't see in their report of laying people off is the fact that last year their CEO made, just with salary, this isn't additional financial benefits, $5.6 million, and Jefferson Health reported profits of $232 million. So when I hear you guys crying poor about the poor doctors and the poor health systems, wah, they're flush with cash, they've got gobs of money, they're protected by insurance, and it's all a for-profit scheme. That's not to say that every doctor means bad or they want to hurt people. That's not what I'm saying. There's a difference between the doctors and the system, and that's what so many people I encounter fail to recognize. They think that the corporate administrators or the bean counters at the top share the same compassion as the kid that went to medical school to save lives, and it's just not the case. But it's not the doctors running the show, it's the administrative people, it's the money people.
So let me ask you, do you feel like Trump is to blame for the state of healthcare being downsized and scaled back and closing and laying off? Is it the Trump administration that's responsible for this? Or is this greedflation? Is it the corporations being too greedy, overcharging and gouging the people for so many years? You tell me. Put your comments below. Let's talk about it. This is Where Is the Money? Talk to you soon.